All right. Good morning and good afternoon, everyone. We're going to continue on with our lecture here today, and then we'll move into some discussion of some vital signs and how to perform different things. Okay. So last time we talked about different tests we can do as clinicians. Um, One of the ways we can do a history and physical and uh, and how we perform different things that will tell us what what patients are possibly suffering from. One of the things we can do is auscultate. We can listen. We can listen to lungs. We can listen to heart sounds. We can listen to bowel sounds. If I stick the stethoscope to your neck, I can actually hear the blood going through your carotid arteries. So there's many different things we can do. I can auscultate your blood pressure, which means I can listen to your blood pressure, or I can palpate your blood pressure, which means to feel your blood pressure. So these are two things that we can use to give an examination of our patient. Now, like I mentioned last time, there are times where you can auscultate a blood pressure, and then there might be times where you have to palpate it due to the fact that um, maybe you're in a loud area to where listening to it would be extremely hard, or maybe they have a really faint blood pressure. There are some patients out there that when you're listening to their blood pressure and you just hear, I mean, it's loud, boom, 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 and you can't miss it. And on the other hand, there are some patients where the blood pressure is very faint, and you have to be listening very closely, or you'll miss it. And so sometimes we have to resort to a different method, which is called palpating it. And we'll talk more about how to do that when we talk about how to take vital signs. But the other thing we talked about was percussion, tapping over various parts of the body, producing a vibrating sound, and it can give the indication of air somewhere, or if there's fluid built up, if it sounds hollow, does it sound solid? So the clinicians will also use this test as well. Care of the patient. Caring for the patient involves three major steps. First, obtaining a history. I'm going to ask the patient about their personal history, their family history. I'm going to ask about the history of this present illness. So one of the things we use, and we'll talk about this when we talk about vital signs, is sample. It's an acronym we use in emergency medicine, and it allows us to be able to hit all the categories that we need to get a physical or a history on. Everything from what are the signs and symptoms of this current illness? Do you have any allergies to any medications? Are you currently taking any medications? What's your past medical history? Do you suffer from any medical problems? When was the last time you ate or drank something? And then how did this particular incident start? All that stuff together, we can start forming a patient history and trying to determine what is going on with this current illness or injury that they're having. Now, from there, we go into performing a physical exam. Now, this can look different depending on what kind of clinician you are. EMT and a paramedic, this is going to look completely different than a physician doing a history and physical, or a physical examination, I should say. Ours is more rapid. We are looking for certain things. A physician is more comprehensive. They aren't necessarily looking for one thing in particular. They're just trying to get an overall examination of how the body is functioning. In the field as paramedics, we are trying to determine what is going on with this patient. So we can try and have a beginning point, so we can try and have an ending point, which is us treating whatever is going on with them. If it's a diabetic emergency, well, the endpoint is going to be if they're hypoglycemic, I'm going to give them sugar. I'm going to give them, it's called D50. And I'm going to try and get their blood sugar back up to a normal range, and that will help them feel much, much better. And so, it looks different. A physical examination looks different depending on what specialty you're in. And nurses is going to look a little different as well. Okay. From there, we have, so putting 1 and 2 together, putting the history and then putting the physical examination in together, we are able to start to hopefully put some clues together as to what's going on with this patient. And then from there, we can order certain diagnostic tests. We can order lab work, different blood workups. We can order different radiological images. We can order different clinic procedures to be done. Say if they need, say they need an angiogram. We can, if they're having chest pain, suspected blocking of the coronary arteries, we can send them for an angiogram that's probably going to tell us and show us exactly what's going on there as far as the coronary arteries are concerned. So all these things put together can give us a clearer picture of what's going on with the patient, and then how do we go and start to treat that patient. Okay. The disease, the cause of the disease process is known as etiology. What is the etiology of Ebola? What's the etiology of influenza? Okay, what is the cause of this? All right, so this is when you hear me use the word etiology, I'm talking about the cause or the beginning point of. Nosocomial disease is one where you acquire this from a hospital or a clinic or basically a healthcare setting. Now, for example, my wife had a part of skin cancer removed off her back. And one day I was in the bathroom and she was getting ready for work, and I just noticed this wound on her back. I'm like, honey, have you seen this? She's like, yeah. She goes, it's getting redder. And I'm like, that looks like staph. And so she goes into the doctor, and sure enough, it was staph. She had got staph from the dermatologist's office where she had this little piece of skin cancer removed. And so they had to pack it full of stuff. They gave her antibiotics. I had to put a cream on her back 3 times a day, or sorry, 2 times a day, and then put a Band-Aid over it for it to heal. And it left a scar. So she has a small little scar on the middle of her back from where this staph infection surfaced from. And actually she got 2 staph infections from there because they removed 2 different parts, and she developed staph in both wounds. So it's something that can develop, and post-operative patients develop staph infections from surgical equipment that wasn't properly sterilized. So that's why nowadays you'll see a lot of, especially if you go to dentists, you'll see them open up a package and stuff right there that has all the instruments in there. Well, that kind of gives us, a peace of mind. However, if that equipment wasn't sterilized properly prior to being put in that sealed bag, then we are at risk of acquiring a staph infection anytime we go to a doctor for whatever procedure. Child develops cold after being exposed to other sick children in the pediatrician's office. For example, chickenpox. When I was a kid, when I was in middle school, I actually had chickenpox, and it was really, really bad. Our family physician said it was the worst case of chickenpox he had ever seen. So, but prior to this, when my mom called to get the appointment for me, they're like, you need to bring him in through the back. Don't bring him in through the waiting room. Just, call us, before you leave. This is prior to cell phones. We didn't have cell phones back then. And then knock on the back door, and we'll let you in and walk you into a room. Well, my stepdad took me, not my mom, and my mom failed to relay that message. So here he is. I'm in 8th grade, and he goes marching me through the clinic office, and we sit down there in the waiting room, and there's all these kids in there, I remember it was a Saturday morning, and I'm just covered in chicken pox. And I'm sitting there and everyone's staring at me. And the nurse comes out and she's like, what what are you here for? My stepdad's like, well, we think he has chicken pox. She's like, why are you sitting in here? He's like, where else am I supposed to go? We're like, I believe we told your wife to bring him in through the back door. He's like, oh, I never got that message. So I possibly exposed all those kids in there to chickenpox. And that could have been a nosocomial infection that they developed because I happen to be sitting there and I'm just covered in chickenpox. Diagnosis, the process of basically naming the condition. We have done our history and physical. We've ordered whatever diagnostic or lab work or other procedures that need to be done. Now we're able to hopefully come up with a diagnosis and then put together a treatment plan to treat this patient. When clusters of findings with more than one disease are found, they are called syndromes. So when you start finding multiple things in around someone, then we call that a syndrome. Diagnosis is needed to determine the treatment of potential outcome of a disease. We need to name what's going on with this patient in order for us to treat it. Sometimes it's very clear cut. Other times it's not so clear cut. Other times we are still trying to throw things against the wall to see if it sticks. and those cases, it's hard. I mean, there's been times where you'll read an article, you'll read in the news about a high schooler or middle schooler. The doctors couldn't find out what was going on with their loved one. So they hopped on the computer and they did a lot of research, and come to find out they found what was going on with their loved one. There are times as us as clinicians, we just can't put a name to it yet. We can rule out some things, but we can't rule out everything, and that leaves us with one glaring diagnosis. So the more tests different scientists make and more diagnostic tools we have, the better we have become at this. But there are going to be times where you may be stumped as a healthcare provider. You are just not sure what's going on with this patient, and that's okay. Keep at it, get more people involved, put multiple heads together, and let's figure out what's going on here. Because the truth is, you may have not seen something that someone else with a little more experience has seen, and they may recognize one small thing. They're like, oh, I had this in a patient I had a couple of years ago, and it might be this condition, just from one small thing that they may have seen in the last case. And so that's a learning experience from you and a time for you to grow, but also a time where we can place a name with the condition and hopefully start a treatment plan for the patient. Treatment, therapy. Treatment of disease should be as precise as possible in order to attempt a cure. We need to really hone in our therapy and try to figure out what exactly is going on so we can put together the most comprehensive treatment plan we can. Infections, we'll send off lab work. We'll take swabs of it and grow them and see what cultures come out. And then we know what antibiotics or whatever to prescribe for it. There's certain bacteria react to certain antibiotics better than others. And so we need to try and figure out as best we can what is this patient actually suffering from, so we can really hone in that treatment plan. Treatment interventions may include exercise, nutritional modifications, physical therapy, medications, surgery, and education. A treatment plan does not always involve drugs. It just doesn't. There's a branch of doctors out there. You have MDs and you have DOs, doctors of osteopathic medicine. and they work in the hospitals along with the MDs, and many times in especially in your ERs, you're more apt to see DOs than MDs. And all this means is they take a more holistic approach to the medicine they practice. They aren't as quick to prescribe meds. Let's try and figure out what's going on, and if we can treat it without meds, great. If we need meds, so be it. So they take a more holistic approach to the body and try to really form their treatment plans to fit that holistic approach. Sometimes treatment just involves physical therapy. Maybe, for example, a couple of years ago, the latissimus dorsi tendons and ligaments and muscles in my neck were extremely weak, and one day my neck just started popping, and I started getting massive headaches, and you heard a grinding in my neck every time I turned my head, and it just hurt. It was very uncomfortable. Went to the doctor, and they're like, yeah, you need to work out these muscles a little bit more because they're really weak right now. And so they put me with a physical therapist in order for me to start working on exercises on how to build up these muscles so I don't have that weak spot in my neck anymore. And there are going to be times where something does require surgery. I had my gallbladder taken out about 8 years ago, and it was emergency gallbladder surgery. I had no idea. I woke up really early in the morning, and I was throwing up uncontrollably, just excruciating pain. My wife takes me to the ER, and they ran all these different diagnostic tests. They did sonograms of my abdomen and still couldn't find out what was going on. They're like, well, your gallbladder looks fine, so we don't think it's your gallbladder. You got a couple of gallstones that they saw in the CAT scan, but nothing that it should be causing you to feel this way. So I was hospital for 2 days, and they're like, this was on Thursday. And they're like, if Saturday morning comes around, you're still feeling this way, then let's take you in and see what we find. Saturday morning, the surgeon comes walking in. He's like, well, Chris, how do you feel? I'm like, I still do not feel good. He goes, well, let's go and take you into the OR, open you up, and we'll look around, see what we can find. Well, sure enough, it was my gallbladder. The very thing the doctors told me looked fine in the sonogram. When they opened me up, they saw clearly it was not fine. It was very close to rupturing and spilling all that poison and bile into my body. And when I went in for my post-op visits, I asked him, I said, so when you all did these tests and you saw that it was fine, how did that happen? He goes, well, your gallbladder is intrahepatic, meaning it sits behind the liver. So we really couldn't get that good of a view of your gallbladder. The parts we did see, we thought looked fine, but clearly it wasn't. And he told me that my gallbladder should have came out years ago. So I was very lucky in that regard. And I was actually in the hospital for a total of 5 days, but they had to do surgery on me. That there was nothing else they could have done. My treatment intervention required having my gallbladder removed. 3 common therapies: supportive therapy, conservative therapy that includes rest, nutrition, fluids, possibly antibiotics to prevent a secondary infection, and hopefully to give the immune system time to function and do its job. Okay, you're just supporting the immune system. You're just supporting the body in doing what the body's supposed to do, which is try to fight off and ward off all these infections. And sometimes you have to help it. You got to assist it a little bit. And when we prescribe antibiotics and stuff like this is what we're doing. We're providing supportive therapy. Palliative therapy. It's not a cure. It basically is to provide some relief from signs and symptoms. I think Tamiflu will fall under a palliative therapy. Tamiflu is not a cure for influenza. What it does is it's supposed to alleviate some of the signs and symptoms and make the the time frame of the flu from it being 7 to 10 to 14 days to relatively shorter, 4 to 5 days, before you can get back out there and feel your best again. And then also this treatment can be used for terminal illnesses where there is no cure for a terminal illness. All you're doing is you're just providing them some relief until they pass away. That may look like painkillers. Sometimes many times if you have a terminal patient, they may be on a pain pump, which is just a medication pump that has pain meds in it, whether it's Darvocet, anything like this, anything that's a pain reliever, a derivative, typically an opioid, then they hit the button whenever they feel that marked pain coming on, and it times them out. So they can only press that button so many times before it locks it out because they've received enough, what the max dosage is until whatever the next time frame may be, whether it's 4 hours, 6 hours, or whatever that the limits are set on the medication pump. Sometimes it's going to look like just providing just some fluids to help them until they pass away, because one of the worst ways to pass away is through starvation and dehydration. And so it could just mean providing them just a little bit of something so they don't go into that starvation mode. So we use palliative care a lot when we talk about terminal patients, and when we have hospice nurses, that's another thing that the hospice nurses are providing is palliative care. Preventive care. Care is given to prevent a disease. Ladies, part of your preventive care when you get older will be mammograms. You should get a mammogram every year. I think they lowered the age. I think it's now 35 for mammograms, unless there's a history of breast cancer in your family, and then it may start out much sooner. Routine blood pressure screenings, myself included. I was diagnosed with high blood pressure last November, so I take a blood pressure medicine to keep it under control, and I monitor my blood pressure. If I start feeling bad or I start getting a bad headache, everything, then my blood pressure may be up. So I take my blood pressure and see where it's at. Routine dental care. All of us should be seeing a dentist twice a year for cleanings. This also helps with overall systemic health. And studies have shown that if you have poor dental hygiene, you run the risk of developing heart disease. And so making sure that your teeth are healthy is a way also to ensure that you're cardiac healthy as well. And here I am, I'll be 46 next week. I know I'm old, but sometimes I feel it, most days I don't. But here I am, 46 as of next week, and I don't have any cavities. So I'm happy by that. My wife resents me for that, but I got lucky in that regard, and I don't have any cavities. But like I said, I go in twice a year and get my teeth cleaned and get x-rays taken just to make sure that my overall teeth, dental, and gum care is taken care of. Men, for us, this looks like is also, as you get older, a prostate screening to ensure that you don't have prostate cancer. All right. Ladies, like I said, mammograms, self-examinations in the showers, feeling for lumps around the breast as well. This is something that should be done when you get a little bit older, constantly, because there may be times if you only go get a mammogram once a year, you need to get yourself self breast exams every month to ensure that nothing pops up from the time you had your last mammogram to the time you're waiting for your next one. Because if you start to feel a lump, then you need to notify your doctor and they'll send you in for another mammogram. All right, so that's another thing of preventative care and preventative therapy. Okay, colon cancer test. Yes, when you get older, you'll have to do colon cancer tests. If you like, for myself, it, there's no family history of colon cancer, so the doctor is not making me do this anytime soon. He's like, no. He goes, if you have a risk of colon cancer in the family, then we would suggest it. But as of right now, you have no risk of it. So I'm luckily I've not had to do anything as far as that is concerned. Prognosis. So once we've diagnosed a patient, then we can give a prognosis. Often good, guarded, poor, and a lot of times if you get diagnosed like with stage 4 cancer. So let's take Alex Trebek, for example. Alex Trebek is the host of Jeopardy. I think 2 years ago, he was diagnosed with stage 4 pancreatic cancer. Typically, that is an automatic death sentence. One of my professors in college who had a profound impact on me as a student of history, he died of prostate cancer. Him and I were really close, and his son actually reached out and told me of his father's passing. So, I had a good relationship with the family, and he told me he suffered from pancreatic cancer. So pancreatic cancer is one of the most aggressive forms of cancers out there. Now, Alex Trebek has kind of bucked the system. He's still alive. He's still doing Jeopardy, and he seems to be in relatively okay health right now. And there's a lot of experimental therapies out there that they've been doing. Hopefully it works. Hopefully that we can come up with a cure for pancreatic cancer, because it's a very aggressive and very devastating form of cancer. And typically, if you're diagnosed with stage 4 pancreatic cancer, they give you a very poor prognosis and say, I'm sorry, this is not good. We'll do whatever we can, but just understand this is not good. Anyone that suffers from ALS, also known as Lou Gehrig's disease, often there is no cure for Lou Gehrig's disease. So as the disease progresses throughout the body, the patient will receive a poor diagnosis. All right. Like breast cancer. There's so many advances in breast cancer now, so many great therapies out there, that breast cancer is not a death sentence anymore. That's not to say that there are some people who get it and don't find it until it's reaching a very advanced and aggressive stage, and then they can get a poor diagnosis. But there's lots of good things out there to help and fight breast cancer now. So it's not a death sentence anymore, thank God. Communicable disease, a disease that is transmitted from one person to another. HIV is a communicable disease. Tuberculosis is a communicable disease. Ebola is a communicable disease. So any disease that I can transmit to you is listed as communicable, okay? And we'll talk more about this when we actually talk about infectious diseases. Epidemic. Hopefully by this time in 2020, we are very versed in the phrase epidemic and pandemic. Epidemic is a disease that affects many people in one given region at the same time. So let's take Europe, okay? COVID started over in Asia, China specifically, moved across the Asian continent, and then went to Europe, where it had devastating effects in Europe. It decimated Italy as well. And so that is an epidemic. Now, what we find ourselves in is the pandemic. A pandemic is a disease that affects many regions and many people at the same time. So we have COVID here in the United States. We have COVID in Asia. We have COVID in Europe. We have COVID in South America. So at the same time, so we are currently in a pandemic. Endemic, a disease that appears to be indigenous to a particular area or region. Okay, dengue fever, something like this. Um, this would be an example of an endemic. Okay, and we'll talk. I said we'll talk a little bit more about endemics when we talk about infectious disease. Um, I'm looking at the time. So, and then we have localized disease that is confined to one body area. So, for example, let's actually take a spider bite, for example. A black widow, if you get bit by a black widow, that is a systemic, so I'll use both these at the same time, systemic and localized. That is a systemic reaction. The toxins and poison from the black widow spider will progress throughout the body. It could cause arrhythmias. So it has an impact on the cardiac system. It can cause abdominal pain, nausea, vomiting. So it affects the GI tract as well. It could give you shortness of breath. So it's also impacting the lungs and the respiratory system. So this is a systemic effect, okay? Spreads throughout the body. It doesn't stay localized to one specific area. Now, let's take the brown recluse spider, for example. The brown recluse spider oftentimes is actually worse than the black widow. Here's the reason why. The brown recluse bites you or stings you in a certain area, say your leg, for example. And within a day, it starts to eat away and kill that tissue in that one area. It doesn't infect my lungs. It doesn't affect my heart. It doesn't spread throughout the body. It stings in that one area, and it causes necrosis of the tissue. It causes death to that tissue. It just eats that tissue alive. And oftentimes, if a black widow bite goes untreated, you could lose that body part. So if it gets bad enough and you develop gangrene in that leg, you may have to have that leg amputated. Okay, that's why if you see a bite, keep an eye on it. If you start to see it turn black, you need to go to the doctor now. All right, because and once again, a brown recluse is their bite is localized. Black widow, their bite is systemic. Okay, so when we talk about in a disease process, a disease that just impacts one body area, one area of the body, that is a localized disease. But a disease like diabetes has a tendency to impact many different body systems. Okay, asymptomatic. We hear this a lot now with COVID. They may be positive of something, but they do not show any signs and symptoms. All right, so let's just stay with COVID, for example. So someone may test positive with COVID, but not having any signs and symptoms. No fever, no cough. Their sense of smell may still be intact. Their taste buds may still be working properly. All those are early signs of COVID. But these patients, for the most part, won't exhibit any of these symptoms. Okay. So that's asymptomatic. Remember, whenever we put an A in front of something, that means without. Okay, so without symptoms. Self-limiting disease, a disease that does not require treatment to be cured. It will resolve on its own. Common cold. That we don't have a cure for the common cold. It just runs its course. Okay, you get it. You feel like crap for a couple days, runny nose, watery eyes. You just feel blah. And you could take things to alleviate the signs and symptoms to, like Dayquil for the daytime, NyQuil at nighttime to help you sleep. But it's not a cure. It just has to run its course. It has to run through your system, has to go through its process, and then you start to feel better. Basic cellular functions. All of y'all should know this really well. Mitosis, electron transport chain, and Krebs cycle. I'm not going to spend really much time on that at all. Interphase, prophase, telophase, anaphase, telophase, and cytokinesis. Okay, this is cell division. Process of a cell replication makes an exact copy of the cell. okay, splitting into two along the poles, and then forming two identical daughter cells. Krebs cycle, turning glucose into energy, turning it into ATP, adenosine triphosphate. Okay, this is what gives us energy. This is what gives us, this is our power plant for the most part. Electron transport system. This is the creating of the ATP. Without the electron transport chain, only 6 ATP can be generated in our cells. With the electron transport chain, up to 34 adenosine triphosphates can be generated. Okay, so this is what we use to power the body. And that actually concludes the basics of Patho. Okay, let me see how much time we have remaining here. I'm actually going to stop it right now. We have like 30 seconds left on the timer. So next time, what we're going to do, we're going to start talking vital signs. We're going to talk about how to take them. We're going to talk about what they represent, how to go through and do a patient history and physical. And so we'll start that next time. All right. Now, at this point, I'm going to go ahead and open up to questions.